Thank you so much for joining us today for our presentation in which we'll reconsider safety metrics. Just a quick note here, the session today is informational only and it cannot count towards continuing education credit. Two housekeeping items before we get started. The presentation is being recorded and we will provide you the recording and the slides to the email address you registered with, most likely next week. If you experience any technical difficulties today, we'd ask that you just use the questions function. It's generally found on the right-hand side of your control bar, and that will actually message us privately. You're also welcome to use that same function to enter in your more general questions for our presenters today, and we'll try as best as we can to answer all the questions before we conclude. Lastly, there'll be a short survey at the very end of the webinar, and your feedback would be appreciated. A little bit about Vector Solutions here. I'll go quickly because we've got a lot of good stuff to cover today, but my name is Carol. I'm a marketing manager here at Vector Solutions. I'm going to be your webinar moderator. You can see a little bit about what we do here, primarily online training and learning management tools, but for some light reading later, you can check out the slide here or more at vectorsolutions.com. All right, and now without further ado, I'd like to introduce to you our hosts and presenters for our webinar today, Jeff Dalto and Pam Woloski.
All right, hey, thank you very much, Carol. Hi to everybody out there. Some of you may be familiar with Vector Solutions, with Carol, with myself, Jeff Dalto. I write the Convergence Training blog. If so, welcome back. If you're new, hello, great to meet you. Feel free to follow us at the Convergence Training blog and LinkedIn. There's some information about myself, but I'm not the star of the show today. Our friend and frequent collaborator, Pam Woloski, is with us. And so I would just want to introduce Pam and thank her and say hi. How are you doing, Pam?
I'm good, Jeff. How are you? You got some information there on the slide about me. I won't spend a lot of time, but yeah, you're right. We've collaborated together on a couple of different topics over the past couple of years, and I'm looking forward to this one. So if you're ready, we'll go ahead and get started.
We're ready, Pam. Steer away.
Excellent. Just a quick, this is our agenda for today, and obviously we'll dig into each of these bullet points a little bit more. We're going to talk a little bit about the names that we call these things, lagging indicators and leading indicators, talk a little bit about some points of confusion, some areas where they don't seem to really sync up in a way that's beneficial to occupational safety and health. And then at the very end, we'll make some recommendations on how we might be able to change the narrative on how we measure occupational safety and health performance.
All right, so Pam, there's a kind of interesting story about how you wound up here giving a webinar on safety performance, safety metrics and indicators. I wonder if you can just kind of walk us through that process.
Yeah, so a couple of years ago, one of my clients, clients with the company that I work with now, had asked me if I could help them transition from lagging indicators to leading indicators because they felt like that was something they needed some outside help with. And I thought that was a great project because I'd sort of been reading a lot and thinking a lot about lagging indicators and why they weren't very helpful and the problems that they caused. And I thought it would be a great opportunity to sort of really dig into that topic. So I took the project, and getting ready for the kickoff meeting, I started to do some reading. Really just an in-depth review of what was out there on leading indicators and lagging indicators. And that's where the problem started. This is a picture of Alice going down the rabbit hole, if you're familiar with the story of Alice in Wonderland. And that's really what happened to me. I went down the rabbit hole trying to figure out what was true, what was correct, what people really believed, and how then I could figure out how, first of all, to help my client, and then ultimately to really be a better consultant and a better occupational safety and health professional. So we're going to talk about that. Prior to that, though, you and I had a conversation back in January of this year, which actually was really as I was beginning to put some of these things about metrics and measurement together. And we had a really good conversation back in January. So that is certainly something I would recommend folks want to do some deeper listening. That's available to you as well. And then last but not least, in August, Professional Safety Journal, which is the periodical of the American Society of Safety Professionals, of which I'm a member and a board member, published an article, and here's a picture of the article. It is a much more in-depth discussion about what we're going to go over today. So I recommend that to the folks on the call. It came out better than I expected. So I'll kind of give that little toot my own horn comment there. So we're going to get ready to have a poll, and Carol's handling that for us. So we'll see if she has anything she wants to say about the poll.
All right, thank you, Pam. So to all of our attendees out there, just launched a quick poll. What are you or your organization currently using to measure safety performance? Are you using just lagging indicators, just leading indicators, maybe a blend of lagging and leading, or measuring? You must be silly. All right, so we've got about 66% saying they're using a blend of lagging and leading. It looks only about 10% are not measuring, which is a good sign, so that's great. So I'm going to close in just about a second here, but on the whole, Pam, it's looking like a blend of lagging and leading came in highest at 67%.
Great, thank you.
So in discussing this with you, Pam, and tracking your lead on the issue in the past year or so, it seems one of the things is there's just a lot of confusion about names, and I wondered if you could walk us through that.
Yeah, absolutely. So first I want to just add this one particular slide, which really doesn't have necessarily anything to do with occupational safety and health per se, but I think I hear a lot of metric indicator KPIs sort of used interchangeably. And maybe this is remedial for some of the folks listening, but I just want to level set, as they say. So a metric is a standard of measurement. It's a data point. It tells us something about something, but it doesn't necessarily give us the depth or the context about what that number means. I call them tallies, sort of. I think that's a better way to think about them. Indicators are groups of statistical values that give, and the traditional use of the word indicator is the health of the economy, or in this case, the effectiveness of our occupational safety and health program. Indicators are usually made up of at least one or more metrics, and they're based usually on live data that's being tracked on an ongoing basis. And then indicators can rise to the level of key performance indicators. Not all indicators become key performance indicators. We may be having, in our organization, we may be having 10 or 12 different occupational safety and health indicators, but within our organization's business performance, only one of them is tracked as a KPI. So we're really looking at critical business performance when we start to talk about KPIs versus just plain old indicators. Leading and lagging indicators, as I just mentioned, they're traditionally, and they come from, those terms come from economics. And on the slide that you see now is the information that's out there on how they're used in economy. And leading indicators are predictive, but not always accurate. And if you remember back in the good old days before the pandemic, there was a lot of talk about this reverse yield curve, which typically predicted a recession, and there was a lot of talk about this leading indicator of this yield curve that was going to predict a recession. We'll never know if that would have ended up happening because things changed, but that's an example of how leading are used in economy. Lagging indicators then measure the changes after the economy changes. They're not predictive, but they conform trends or outcomes. And I highlighted this here because I think this is really important in terms of how we think about lagging indicators and the idea of tying lagging indicators to leading indicators. And so they do run together. When you talk about leading and lagging indicators in economics, we don't generally pull them apart. We have a leading indicator, we look and see if the economy starts to change, and then the lagging indicator confirms our trend or our outcome. I found a lot of terms in my literature review that are used for lagging and leading indicators, and you see some of them on the slide right now. And I thought a lot about that, and I thought, you know, typically I think occupational safety and health professionals use the terms lagging and leading, but that's not what everybody else always uses. And then I started to think about whether or not lagging indicators and leading indicators are opposites. We tend to treat them that way. It sort of aligned with what I was just saying a couple of minutes ago. We sort of have them sit out there by themselves. We may be measuring a lagging indicator based upon our incidents, and we may be measuring a leading indicator based upon some proactive safety activity, but we don't have a tendency to put them together. But I believe that we need to start thinking of them as points on a continuum. And we'll revisit that idea when we get to the later point in our discussion, when we're talking about some recommendations and some changes. So I've begun to think about lagging and leading, or whatever term you choose to use, tying them together as opposed to isolated. The Campbell Institute, if you're familiar, is part of the National Safety Council, and they convened a work group in 2013 to explore this idea of indicators, particularly leading indicators. And so what they did in this particular survey was they asked the folks about whether or not indicators, how they're used within their organization. And so you can see a flip, right? For executive compensation, indicators for occupational safety and health have nothing to do with their compensation, really, for the most part. But for occupational safety and health professionals, their accountability, not their compensation, but their accountability and how they're judged is the flip side. For the most part, they really are judged on indicators and the performance of indicators and the success of indicators. So that's another area of disagreement within our organizations, where our senior executives aren't really paying attention to them or being held accountable for them, whereas occupational safety and health professionals are. And then I read some stuff. There was an article by Fred Manuel, who's been a thought leader in our profession for many, many years, a person that I respect greatly, had an article in Professional Safety Journal, and he talks about how sometimes lagging are used as leading and leading are used as lagging, and they kind of flip back and forth. And he used the example of problems with performance of a particular piece of equipment, and that was a lagging indicator that the equipment was failing and causing property damage incidents or something like that. But then he talked about using as a leading indicator that to turn it around to say that we needed to change our perspective and find a way to be more proactive at our inspection of that particular type of equipment. So the terms didn't matter so much in there, but his example in this particular article began to really solidify that concept of tying leading and lagging together in some sort of a process. And then a couple of other these are rather long quotes, but I kind of helped you out by highlighting in bold and underline the really key points of both of them. This is from Anthony Hopkins, and notice this is from 2007. And basically he did some literature review, and he said there really wasn't any consistent use of the terms. And basically he came down to the conclusion that it really didn't matter whether we describe them as a leading or lag. Really the purpose of what we use them as opposed to what we called them was really more important to him. And then again, back to Fred Manuel, he talked in the same article we were just referencing. Again, he just reiterates the point. It doesn't matter what we call them. There's kind of a gibberish part to a differentiation. And that was kind of when I hit the bottom of the rabbit hole, and I thought, okay, I need to figure out a better way to look at these things, look at leading indicators and look at lagging indicators. And that was kind of where I started to put some pieces back together.
Okay, Pam, can you take us maybe in a deep dive specifically into lagging indicators and how they've been used and what they are and all that kind of stuff?
Right. So lagging indicators have been, and at the very beginning, I talked about how more and more you were hearing folks in our profession talk about maybe they aren't such a good idea after all, but for the most part, they are still very popular. And so why is that? Part of what I've come to believe is that it's the devil we know. I mean, I've been doing this for almost 30 years, and we've been talking about lagging indicators, different kinds of incident rates and EMRs and things like that for as long as I know. And so we're comfortable with them. We know them, we understand them. We know how they're calculated, and they're calculated the same. Everybody calculates their TRIR the same way, and the EMR is calculated in the same way. And they can be easily analyzed and interpreted, although I would add the point that we don't always do that as well as we should. And they can show progress towards a goal. So if we have as our indicator that we want to reduce our TRIR by 50%, if we reduce our TRIR by 50%, we've achieved that goal. And that's a positive thing for our organization. And everybody's happy when we meet that goal. But I doubt there's a professional out there these days practicing who hasn't been in the position of having that goal not met. When you are on day 360 of trying to meet a particular goal, and then on day 361, that goal gets wiped out for the entire year. So that's a problem. They're unpopular, I think, for also similar kinds of reasons. Partly we've talked about before, they're not aligned to business. We have this tendency to have occupational safety and health indicators sort of sit out there by themselves. They're not really tied into how the organization operates. And one of the recommendations we'll talk about at the end is trying to find a way to change that. But in business, indicators used in business are not measured by a lack of something. So lagging indicators are a lack of success of our program because somebody got hurt, somebody almost got hurt, or we damaged some property. But you wouldn't see a business indicator for the financial health of an organization phrased as not losing money in 2020. You wouldn't hear an indicator tied to your marketing efforts as not losing market share. So we're flipped from what organizations do in terms of how they measure their business successes. And as I mentioned before, the historical context, we've told our executives that these are important, and we have believed that, and I don't hold it against us for maybe not being correct, but we've told them that a good TRIR, a low TRIR, is a valuable benchmark. And we've said that over and over again. And so now what happens is our management overreacts when we have a failure. And many of us have been in the position where we have an incident that occurs and we spend a lot of time digging into that incident with an investigation and a corrective action plan and tracking the corrective action plan. And what it does is it takes our time and energy away from things that we might not be able to get back to that could be better for the organization in terms of its performance. And then statistically, I think we don't do as good a job as we can at analyzing lagging indicators, really digging into them. I think we're not as good at using statistical analysis tools to do that. Maybe we had that in our undergraduate or graduate degree programs, but I don't know about you, but mine was a really long time ago. And we also have a tendency to think that aggregating data, those rates are not always very meaningful. That big TRIR, what's in it is meaningful, but the number itself may not be. And the failure of one incident to skew an entire rate, particularly for those of us who may work with smaller organizations. So definitely a problem there. This is a quote out of the Global Reporting Institute's document 403, which is their guide for reporting health and safety. If you're familiar with GRI, they publish standards for how to measure and publicly report on all kinds of things, sustainability, ESG, all of those kinds of issues. And this is the one for occupational health and safety. And so they talk about how injuries, which would be a traditional lagging indicator, is really only a measure of the harm. They're not a measure of safety. And I like this quote because I think that's why many of us are uncomfortable with the way lagging indicators are used. They are not a measure of safety. They're just simply a measure of incidents that have occurred typically. Just because we have a low TRIR doesn't mean we have a safe organization, and vice versa.
Pam, it's kind of interesting. When we were sitting waiting for the webinar to begin, you're just talking about statistical analysis and TRIR and everything. And we just saw the Construction Safety Research Alliance publicizing a recorded webinar of their own titled "The Statistical Invalidity of TRIR." So certainly encourage people to check out a bunch of resources. Pam's got a reading list for you at the end. She already talked about her ASSP Professional Safety Journal article. We'll give you more articles. Check out that Construction Safety Research Alliance webinar as well. But with that, Pam, if you could maybe go ahead and move forward, I'll quit interrupting you and maybe talk to us a little bit about leading indicators.
Sure, and I'm looking forward to listening to that too, because I do agree with the title of the webinar, so it'd be interesting to hear what it has to say. These are just some characteristics, and I've highlighted them in bold from a couple of different sources that I found that talk about what a leading indicator is. It monitors, it predicts, it's well communicated. There's a variety of different ways that we do it, but like lagging indicators, there really isn't any clear agreed upon definition of what a leading indicator is. Even as we said before, there isn't any clear use of a particular term to describe what we typically think about as a leading indicator. But the GRI, again, the same Reporting Institute document we were talking about just a few minutes ago, again, they talk about leading indicators measure prevention of work-related injuries or ill health, and the importance of not relying solely on lagging indicators. And I like this particular quote because one of the things that I've come to appreciate that I didn't appreciate before is that the solution to measuring our occupational safety and health performance isn't throwing out lagging indicators and moving to leading indicators. I really do believe that they both have a role and a purpose, and if we can use them in different ways and rethink the way we use them and develop them and present them, I think that they can both continue to have value for an organization. One of the things that surprised me as I read was the idea that leading indicators and the use of them would begin to increase. And you can see again from that Campbell Institute study in 2013, 93% of the people who were surveyed for that study said that they would be increasing the use of leading indicators in the next 5 years. And then the ERM Global Safety Survey, which is another survey that's done annually, 5 years later, said no, not really. And I found that to be interesting. And by the way, I failed to mention earlier the Campbell Institute document that I'm referring to. There are actually 5 white papers that the Campbell Institute has published, and at the very end on the resource slide, they are noted for you. They're easy to find. They're white papers that are free to download, and I highly recommend them to you for additional reading and research as you begin to think more and more about this particular topic. So I guess the question is, what happened? Well, I'm not sure that I have the answer to what happened, but I did find some additional sort of discongruencies when I read more and more about leading indicators. Again, back to the Campbell Institute survey. The occupational safety and health professionals who said that they were either competent, proficient, or expert in leading indicators, developing them was very high, an overwhelming preponderance of those folks. But again, notice the flip side on the executives within their organizations. They really don't think that those folks understand what a leading indicator is and how to use one. Now, I would just add the caveat that they mean a leading indicator with regard to occupational safety and health. They may have a good idea about how to use a leading indicator for measuring business performance, but they don't appreciate leading indicators for occupational safety and health. So another disconnect between what it seems like people thought they knew and maybe they didn't know. And these were some indicators that they had used in this particular article, this white paper, as examples of leading indicators. Now, these may be ones that you're using too, but I would take issue with whether or not these are indicators of anything. I think what you see here are metrics or tallies of completion of an activity. And they may be important to monitor because they are a goal. You may want to have 5,000 training hours completed in 2020. And if you do that, that's a good goal, and you may want to be tracking that, but it doesn't indicate anything. And so calling training hours completed or safety suggestions submitted as a leading indicator, I think, is a misnomer. And quantity of an item doesn't increase or indicate quality. And I think that's what's missing here with these, which was surprising to me because, again, the same folks who participated in this survey with the National Safety Council and this work group, these were ones that they were using in their organization. Now, here I've flipped it over a little bit, and I've given you what I would suggest might be a better potential leading indicator. So training hours, yes, important to track, but do people retain it and learn how to apply what they learned? Are we using job safety analysis to reduce exposure and risk to employees? Are people on the safety committee not just attending for the coffee and donuts? Are they actually involved in something? And are the safety suggestions high quality, or do we implement them, or could we find some way to track whether they made a difference in our organization? So these are harder to measure, but they're more suitable for measuring quality, and they're more suitable for potentially showing some sort of an indication of something that would be beneficial to our organization. Back to Carol for a poll.
All right, thank you, Pam. So for all of you out there, are you or your organization planning on making more use of leading indicators, or have you done so recently? So no plans, not doing so just yet, or yes, we're adding them now, or you've been using them for years. So we're at about a good split between they have plans to do so but have not done yet, and yes, they're about 36% of our audience is in process, so that's pretty cool to see. I'm going to give it just another minute here. So yeah, it looks like we're at 14% no plans, 30% plans but not doing so yet, 35% yes, we're adding them now, and 23% saying we've been using them for years. Back to you, Pam.
Thank you. Okay.
So Pam, given a lot of introductory information, a lot of thoughts, what did you maybe end up suggesting to your client, and what do you suggest people do walking out of this webinar in terms of improving their metrics and indicators?
Great. Yeah, so I'm going to go over 3 sort of different recommendations that I have, but the one thing that I do want to say before I go through this part of it is I learned a lot, as I said before, when I started to really dig into this topic, but by no means do I think that this is not a topic that needs to continue to evolve within our profession. I think it's really clear that we are changing and moving in different directions with how we measure occupational safety and health performance. And so I think there's lots more to be done and discussed about it. These are 3 things that I discovered that have been helpful to me. I'm sharing them because I'm hoping they're helpful to you. And then, you know, perhaps when we're done, we can talk a little bit more about other ideas that folks on the call might have. So the first one has to do with this idea of surrogation. In September of 19, the Harvard Business Review had an article called "Don't Let Metrics Undermine Your Business." And they talked in that article about the Wells Fargo debacle. For those of you who remember what happened with Wells Fargo and the tremendous downfall that they had, it turns out that a lot of it came from a slogan that was an incentive that was developed by the now ex-CEO called 8 is Great. Basically what they said was that if one customer had one product, that was a good customer, but a better customer was a customer who had more than one product. And in fact, 8 products that we provided were great. So if I came to Wells Fargo for a home equity line of credit and you sold me a credit card, that was 2. And so the incentive to the sales force was to get each customer up to 8 products. And if you know what happened, the indicator became the goal, getting to that 8. It didn't matter how we got there. We just needed to get 8 because there were a lot of incentives tied to getting there. And so unauthorized accounts were opened. People opened accounts that they didn't understand what they were getting. There were huge financial losses and fines, and the reputation was ruined. So basically, the lesson learned is that the metric was not tied to a strategy. It was just a number that really didn't focus heavily enough on the strategy. And it was implemented in a way that didn't involve the people who were responsible to implement it. They were just told, get 8 products for each customer. And so, as is what normally happens, getting that indicator met became the goal, regardless of how you did it. And in fact, some illegal ways were used to get to that, which may not be what you've experienced. But I can't imagine that there aren't a lot of people on the call who haven't been in that kind of a situation where an incentive and an indicator were tied together. And so lots of interesting ways to achieve that indicator were occurring. So to avoid surrogation, there are 2 things that you have to do. One, you have to engage management. They have to be responsible for accountability for it, for your indicators, and for the strategy behind it and connecting it to the strategy. And the folks who are responsible to implement the actual engagement strategy and pursuit of the indicator need to be involved in that as well. So just like any other major health and safety initiative, it's that management commitment and employee participation, those 2 pieces together. Those are the kinds of things that can avoid surrogation. And the last one, and this is one that I always recommend, that you never tie an incentive to an indicator. You've got to find some other way to make the indicator meaningful within your organization without rewarding people for achieving it. Because I find it very difficult to find a way to separate those things in ways that make it so that you're not having those kinds of 8 is great kinds of situations. So that's one recommendation. The second recommendation is the concepts of bringing the indicators into processes within your organization. And this is the point we were making earlier about tying them together. And on here, you'll notice that I use the word input indicators and output indicators. And actually, that's the term that I've started to use more often in my discussions rather than leading and lagging. But in this particular context, I think it really helps explain it. So if you are a manufacturing organization, you have things, inputs that go into your process, and you have outputs. You know, you have stock chemicals and different kinds of things that get fed into your machinery, and outcomes plastic that you sell. It's the same concept. A systems view is the same concept. We have input indicators, and then we enact some sort of a process or a program or a procedure or an initiative. And then from there, we measure the success of that by looking at some output indicators, or as we would call them, lagging indicators. So let me give you an example of how this worked with a client of mine in the past, and see if I can't make it make a little bit more sense. So I had a client that had a management system in place, a safety management system in place, and they had a fairly well-defined management of change process. But they were discovering that every time they were doing incident investigations, that the failure of the management of change process was one of the causes of the incident, among other causes. And they noticed that trend because they were tracking the causes of their incidents as part of a data point that they were keeping track of. And somebody said, you know, a lot of management of change problems are happening when we have incidents. So let's tie these things back together into some sort of a process. If we have a management change process and people aren't using it or aren't using it properly, then the process of management of change needs to be fixed. And then that's what we're going to be looking to improve on. So their strategy was, of course, we reduce incidents through the use of management of change. That was really the way they expected the process to occur, that was one of the things that helped reduce incidents. And so the goal was to improve the awareness and the accuracy of the use of management of change. So as an input indicators, they developed and revised the policy. And they had a specific set of criteria for who needed to be the stakeholders who were involved in the revision of the policy and working on the policy. It wasn't just something that the safety professional wrote up. And there were some timelines that were established for how it had to get done and the approval process. And then there were some input indicators for training people and finding out whether they retained the training that they had, and making sure that they learned what they were supposed to learn about management of change, and then some metrics and input indicators that they were looking at to monitor the use of the management of change process. So once they did all of that, they went through a 1-year process initiation of this better improved management of change. Their output indicators were that they would see a 90% correct use of management of change, and that the investigations where the management of change process was a cause would be reduced from the previous year by 90%. So you can see that both of these output indicators have nothing to do with actual incident reduction. There's no TRIR reduction or DART reduction or EMR reduction in those output indicators. They are tied to the process of correctly using management of change. And in fact, after a year, they came very close to both of those output indicators because they felt like they had improved management of change. People knew what it was for and used it properly. So instead of focusing on injuries or ill health or property damage, they focused on a process, a systemic view. And it was a very effective way of connecting those indicators together in a process view. The third suggestion that I have, or recommendation that I have, is getting those indicators away from being isolated from the business. And a little different than what we were just talking about. We were talking about connecting indicators to process. Now I'm talking about actually connecting it to the business. So instead of an indicator being tied to safety performance, improved safety performance, the indicator should be tied to improved business performance. And that should be integrated into the business's strategic goals or its strategic KPIs. So let me give you an example of how I think this can look in an organization. In a previous life before my current job, I worked for an engineering firm. And one of the things that we did a lot of were environmental field services for our clients, primarily in the energy industry. So think wetland delineations, and think of phase 1, phase 2, and phase 3 surveys. Think of habitat surveys where we would go out for a client who was trying to put a new transmission line through a big field that possibly was the migration route for the northern harrier. And our biologists would go out and do a study to determine whether that was true or not. So we did really good at this work. Our clients really liked it. Our teams were very, very good, very effective, very, very skilled at these kinds of activities. And so the business unit director for the energy group decided that as part of his strategic plan for the following year, he wanted to increase the gross revenues for this particular type of service. If we were doing well and our clients liked it, he felt like that was a reasonable goal to improve that. So that was the business goal, the increase in the gross revenues for this particular service line. The problem was that our TRIR was higher than average, and it was higher than the benchmark for some of those clients. And it caused a couple of problems for us. The first one was that we were always spending time explaining our TRIR and what we were doing to try to get it down. And in some cases, we were having clients who were not willing to work with us because our number was above their benchmark. Sometimes they would let us talk to them about it, but other times we were crossed out at the beginning. So we said, look, this is going to be a barrier to the business goal of increasing the revenues. When we looked at the TR a little closer, we found a lot of soft tissue injuries that turned into OSHA recordables from our environmental field services staff, who were out in all kinds of terrain, climbing up and down mountains and wandering around fields, and they would slip and fall, and perhaps they would twist their ankle or bump their head or strain their shoulder or something fairly minor, soft tissue. But because they didn't know whether they should see a medical professional about that injury, they would call me, or they would call their team leader, or they would call their spouse or their parent and say, you know, I just fell and my knee hurts. Should I go to the doctor's? Well, I'm not a doctor, and neither were any of those people. And so what ended up happening is they would end up going to a clinic and end up with an OSHA recordable that maybe didn't have to be. The problem was they were out in the middle of nowhere, so we didn't have an occupational health clinic that we could work with to help us. They often ended up at urgent care clinics. The closest one maybe was an hour away. So our insurance broker turned us on to medical triage services, which are folks that can help strategically determine whether or not somebody's injury is able to be worked with in terms of self-care, rest, ice, whatever, or really needs medical attention. And we thought if we could provide medical expertise to this group of staff on what to do with these injuries, whether they needed medical care or not, that we would have a better outcome, that some of these soft tissue recordables could be avoided if they really didn't need medical treatment. Now, we were not trying to steer people away from seeing a doctor if that was what they needed, but we were not in a position to make that decision for them. So we, as part of our input indicators for this particular process, we had some criteria that we set up for our vendors, and we wanted to make sure that they were available 24/7. We wanted to make sure that the medical personnel were employees of the vendor and not contract folks who, we would have a step away from in terms of being able to work with them. We had to develop very, very specific protocols on how the service was to be used and what people were supposed to do. And if there was an emergency, we didn't expect them to call. We expected them to go for medical care. We trained everybody, we communicated to them, we developed some metrics and data points around retention of the training, and then we inputted and began the process of using this medical triage vendor. Our output indicators were based upon a couple of things, not all of which were associated with decrease in injuries. The first one was the staff satisfied with the service? Because we felt if they were satisfied with the service, they would continue to use it. But if they weren't satisfied with it, they would just go to the urgent care clinic and we'd end up with a recordable, and that wasn't the goal. So every time somebody used that service, we called them and we asked them a series of 5 questions to make sure that they felt they got the care they needed. We also checked on their retention of the protocols to make sure that they did what they were supposed to do. And if they didn't, we called them to find out why. Was there a reason why you didn't call the medical triage service? So those were not related to injury reduction, but they were going to be related to use of the service. And then our third indicator was a 25% decrease, in soft tissue recordables among that particular work group. So the good news is that 25% decrease was achieved. We believed that we had diverted roughly 8 minor soft tissue injuries to self-care that might have gone to a clinic and turned out to be a recordable. So again, the point of this whole particular example that I share with you is the idea came from the business's goal of increasing revenues in a product line where the safety process and progress of our activities to try to minimize injuries was an impediment to achieving that goal. And so this is an example of the third and final recommendation of how I think we can tie safety performance into business performance. So that gives you pretty much 3 basic recommendations, and we mentioned a couple of times that there was some recommended reading and resource lists on here, and here's some of them: the Campbell Institute white papers, a really good book by Karsten Busch. If you can't measure it, maybe you shouldn't. Tongue-in-cheek, but a really, really good book, a very slim book, but a great read. The ANSI ASSP Z10, the updated standard, was updated in 2019. There is a standard and an implementation manual. The GRI document that we talked about earlier, there's the Harvard Business Review article. We talked about surrogation. And a friend of mine, Peter Suska, does some interesting discussions in professional safety on evaluating effectiveness rather than results. And there's some really good stuff in there about this idea that it's not injuries or lack thereof that we should be looking at, it's the process that we come to. So that gets me kind of to the end of my prepared comments today. I hope you've enjoyed this journey, and we've left some time for some questions and answers. So I'll turn it back to Carol.
And Pam and Carol, this is Jeff. If I could just jump in real quickly, I just want to remind everybody, Pam's being modest. In addition to that reading list, don't forget to check out her article at Professional Safety Journal and the recorded interview we did in January of 2020 on this exact same topic. And in regards to Karsten Bush, I'm also a fan of that book that Pam mentioned, and we also interviewed Karsten in March or April about that book and about these topics. Check that out at the Conversions Training blog as well. And with that, I apologize, Carol, go ahead and field any questions for us.
Okay, appreciate it, both Pam and Jeff. To all of our attendees out there, please, this is the time if you have a question for Pam or for Jeff, please just use that questions function in your control panel and we'll get to those. So Jeff and Pam, I feel like we get this question often, but I think it's an important one. This is from James. Essentially, he's asking, when you face, when you're trying to implement new maybe processes or something like adding more leading indicators or things like that, you know, I guess he's asking, what's the first step to bring it to leadership, or how do they make the case for this?
The first step, even before you start to make the case to leadership, I think, is to really get a better understanding of performance measurement.
Right.
And that was sort of the journey that I described, because I thought I knew what I was doing. I thought I understood it. I thought I was ready to go. But the more I read about it, the more I realized I didn't have the depth of appreciation for the topic that would have enabled me to speak intelligently to my, at that point, my client, but in
Right.
James's, to his leadership. So I really think that, you know, understanding a little bit more about the process and indicators in general and performance management in general is the first step. But the second step is related to the very last slide that we just talked about, and that is, how can you connect your performance measurement, your indicators, to business success? How does that process work? It's not just that we want to have less people get hurt. I mean, I think that's kind of like apple pie and motherhood. Of course, we want to have less people get hurt, but how do we tie those indicators and measurements of the effectiveness of our program to the success of the business? And looking
Right.
for a way to tie it, I think, is a better sell than just saying, well, you know, we want to get our TRR down by 50% this year.
Okay,
You know,
great. Thank you, Pam.
If I
Go
could
ahead,
jump
Jeff.
in on that too, I was just reading a book on human performance improvement, which is often kind of similar to these safety ideas. And one of the things, in addition to what Pam is saying, obviously, one of the things they said is see if you can find a partner where you can work on a small project, you know, almost on a beta level, and have a success. And you know, that success will help you persuade upper management that you want to go bigger with the endeavor.
Okay, great. Thank you, Jeff. All right, we've got another question from Patrick. Patrick's asking, could you give me a concrete example of a leading indicator that works most of the time?
No, I can't.
Really tough, but, yeah.
I will give you a couple of leading indicators that I think are fairly universal in many organizations.
Okay.
So maybe a little bit of a tweak on what he was asking, because
Okay.
leading indicators, and sometimes they don't. And if the leading indicator, if you don't achieve it, that doesn't always mean failure. You sort of have to figure that out. But let's go back to that training example that we talked about. A lot of organizations measure training hours, and they measure, you know, they have some sort of a matrix, and you know, 25% of or 100% of this particular workforce category has to achieve this training. And
Right.
that's a metric, and that's an important thing to track. But how do we measure what they retain about the training afterwards? And so I think there are a number of ways that you can develop indicators around training retention. What can you observe in that person's job performance that tells you that they learned a new or a different way to perform a particular skill or an activity? If you do confined space entry training, what kind of metrics can you look at and indicators can you look at around the completion of confined space entry permits? How often are they completed correctly? Because in theory, if people paid attention during the training and it was effective, then they should be able to demonstrate that skill. So I think lots of organizations have that particular issue. The second one I would suggest, many organizations have safety committees. And again, if we have 10 people on the safety committee, having 8 to 10 people attend every meeting is an important metric, and that's good to track. But what does that safety committee do? And how can you show specific information or indicators about what tasks and activities they're performing as part of? And I'm not talking necessarily about just completing a weekly job site inspection. What does that inspection reveal about ongoing problems that you're finding? So it's not just completion of a task or an activity, it's the quality of that and what do you learn from it. So those are the two examples I would give that I think are almost universal in many organizations.
Okay, thank you, Pam. So you're talking about high quality. Speaking of, Jeff has a question. It says, can you say more about high quality safety suggestions? Are these ones that are implemented or of a certain magnitude?
I think they can be both. So, you know, we get a lot of safety suggestions, and just to go back to the comment I made about not tying incentives to indicators, right? So if we have an indicator that we want to get 20 safety suggestions in a quarter, and we have an incentive tied to that, we're going to get 20 safety suggestions. I guarantee it. Or we'll probably get 21, just have an extra one for good measure. So I think getting a number of safety suggestions, a particular type, a specific number is a good idea, but whether that suggestion is implemented or not is definitely one way to measure the quality of it. But in addition to that, and again, this is where it gets a little tricky, you really have to think, what impact did that safety suggestion have on the organization? What can you show from the implementation of that suggestion that improved the overall safety of the organization? So that's really where you have to get very creative, and you really have to think about what changed in the way you do something from the time that before you implemented the suggestion until afterwards. And can you measure that? What's been improved from the before to the after? And that's a way I think that you can take something like that and make it a more high quality indicator.
Got it, makes sense, thank you. So we've got a two-part question from Omar here. Jeff, one of these questions is for you. So what was the book Jeff was reading on human safety performance review?
Hey, can you ask Pam to field the second question, and I'll run upstairs and get the book, and I'll be right back.
All right, no problem.
Now, how long do we
Slow,
have to
Pam. I'll be right back.
Okay. Thank you,
I'm
Jeff.
ready.
Going above and beyond. So Pam, the second question that Omar had is just frankly for you. Are any consulting services that you provide to set up SMSs for companies?
Oh, yes. Thank you. That is a big part of what Specialty Technical Consultants does.
Right.
We work with our clients to develop and implement safety management systems, both environment, quality, and health and safety. And we also are an internal auditor for folks that are certified. So, you know, you have to have regular audits in addition to your certification reviews, and we perform that service for our clients as well. So we do a lot of that. That's a big part of our activities. There's Jeff.
Awesome. Thank you, Pam.
Hi, Jeff. Thank you.
And I'm not on camera because I'm having technical difficulties today. So there you go.
So this is the book I was talking about, Human Performance Improvement by Building Practitioner Performance by Rothwell. For context, HPI is one of these things that comes up a lot in learning and development. And it's pretty similar to a lot of like new safety stuff, including HOP, Safety Differently. So this is the book I was reading here, and it's kind of like kissing cousins with a lot of the new safety stuff. And we had Joe Esty on talking about HPI in one of these webinars recently.
All right, thank you, Jeff. I appreciate it. This question comes from Clay. So isn't your example about skill demonstration still too objective for a data point, especially when trying to drive a change model throughout a young, inexperienced organization?
It's still a data point. No, I guess I would disagree with that. It is a data point that the idea is that it demonstrates something. So if I train you and you spend 5 hours on a particular topic, that's one data point, 5 hours of training. But another data point is how do you demonstrate retention of that training? And that data point could be successfully performing a skill. And I use the example of a confined space entry permit. And so what I would probably want to do is dig a little deeper. It's not just that the permit's completed, but is the permit completed correctly? And so maybe I would set up 10 different points on a checklist, and I would review the confined space entry permit, and I would be looking for how they filled out the permit to make sure they met those data points. And if people were consistently not meeting those data points, then that's a possible indicator that there was a problem in the training somewhere. But if they are, then I think that gives me a little bit of a better belief that the training was successful. So it is a data point, but it's a data point that tells me something. It becomes more of a, instead of just a metric or a tally, it becomes a metric that's an indicator, and it indicates something to me.
Right.
Pam, if I could jump in there and borrow some language maybe from our friend Ron Gant or Todd Conklin, a tally, whether or not, somebody completed the course, has spent X number of minutes in an e-learning program or whatever. As you said, that's just a kind of an empty, meaningless tally, and it doesn't tell me anything about learning or the capacity of my organization, whether or not the capacity is increased. When I've taught somebody to perform a skill that people have learned, we now have a more capacity at our organization, and therefore our organization has an opportunity to be more resilient. Would you say that's all true?
Yeah, I would agree. And so you could, the data point of a properly completed confined space entry permit can also be used to verify that people are entering, at least that people are entering confined spaces safely and doing what they have to do that work safely. It's not an absolute guarantee, but it is a data point that if it's done properly, my chances of having an injury or a serious event as a result of a confined space entry go down. And that's an improvement in my organization, and that shows performance in my organization.
All right, great. Thank you, Pam. This comes from Dr. Eshra. Hopefully I'm getting that right. He or she is asking, what are the statistical tools required to calculate KPIs? So I feel like that could.
I don't think there are any particular statistical tools that are used that are consistently used to calculate KPIs. Right. It depends on what your KPI is and what you're trying to measure. I don't really think that there's a particular tool that's used to calculate that. I mean, certainly at its very simplest, an Excel spreadsheet can help you make statistical analysis of a particular bunch of data points. But I don't know that there is a specific answer to that. I'm not sure if Jeff has any thoughts.
I don't know. I was actually more focused on, just the contextual business strategy. But yeah, other than just numerical stuff that we all know about percentages and the like, I don't have a better answer. Sorry.
Okay, no problem. Dr. Eshra has a second part of that question. How about a matrix? I'm thinking he or she means risk matrix. How can we construct this?
Well, I guess in terms of another tool that can help measure something, a matrix is certainly one way to do it. A matrix, particularly used for occupational health and safety risk, gives us a risk score or a qualitative category, high, medium, low. And then, if we reassess the task after we apply controls, then that risk goes down. So yeah, certainly a matrix would be one way to measure. I don't know that that's well, it could be used to measure a KPI and the success of a KPI. So that point I understand.
Okay, fair enough. This question comes from Tony. This is kind of interesting. Is there no incentive how to encourage employees to actually submit their own suggestions?
There is an incentive. I think if people can, I think there are qualitative incentives for doing so. If your workforce understands the value of submitting those and buys into the value because they've been part of the development of the strategy and why we're asking for safety suggestions, sees them implemented, sees how that improves the work of themselves and their coworkers, that's the incentive. And that's a qualitative incentive. That's not a quantitative incentive like a pizza party or a gas gift card or something like that. And that's really what I talked about in terms of engaging the people who are responsible for implementing the indicators that you're working on, engaging them and getting their idea on what would make their work better, safer, easier to do.
Right. Okay, thank you again. I know we're getting close to the hour here. Just want to try and get to as many as we can here. This from Michael. Some recent research has shown that temporal relationship between indicators and results is much more complex than leading and lagging. Should we consider getting rid of the distinction altogether of leading and lagging?
I agree with the first point about research, and I think that's kind of what Jeff was alluding to in that webinar that's coming up. I don't, like I said, I don't typically use the terms leading and lagging anymore. Right. I really try to focus on process and tying input measures to a process to output measures to really try to put those together. I certainly don't have any objections to get rid of leading and lagging, but probably good luck with that. I think we've been using it for so many years. I think it's going to be hard to get rid of. I think I'm more, and my incentive is more to get people to think differently about how they use them, not so much as what to call them.
The terminal, right. Okay, that makes sense. All right, I want to be respectful of Pam and Jeff's time here today. So we are at 2 o'clock Eastern here. Raul, I see you out there. We'll try and as best we can to send you some information in the follow-up and a few others that we didn't get to today. But I want to thank everybody out there for participating in the presentation today. And I want to especially thank Pam, who, as you may or may not know, she's undergoing some of her own issues out west, no power. So she was kind enough to scramble and get everything ready for us today. So Pam, we really appreciate it. I thought the information was really great. Thank you.
Thanks. I was glad to do it. Yes, technology and power and all those kinds of things have been a challenge for me this week, but I think everything went great. I always enjoy working with Jeff, and so happy to do it anytime.
Well, I underline and second all that too. Always love working with Pam. Thanks to Pam. And I recommend everybody check out Pam on Twitter and LinkedIn, where she's prolific and very informative. So check her out.
All right.
Okay. Thank you, everybody.
Have a great one. Thank you.
Bye, everybody. Thank you.